Namaste and welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We have discussed Shita Guna of Vata dosh and Shita Guna of a Kapha dosh and what is the exact difference between these two. In today's episode, we will discuss the another karma, Shonita Sthapana karma. Now, by the name Shonita Sthapan, it is very easy to understand that it is regarding Rakta Stambhana Karma. Shonita means Rakta, Sthapana means to stabilize. So, whenever there are bleeding disorders, the Rakta Stambhana or Shonita Sthapana Karma is to be considered. Now, as a bleeding disorder, the disease which is mentioned in the text in detail is Rakta Pitta. And they have given the types Urdhvaga, Adhoga, Tiryaga with all Hetu, Pururup, Samprapti, and they have mentioned specifically that it is Mahavega, Ashukari, and you have to treat this patient at very emergency level because there is a profuse bleeding from various parts of the body. Now, this is an emergency condition, and generally, you require some hospitalization in such conditions. So, when we are going to discuss Rakta Pitta as a disease, we will discuss this disorder as a disease at that time. In today's episode, we will discuss the bleeding disorder which generally we come across in our OPD level. So, whenever there is a bleeding disorder, to stop the bleeding, we always use Shitavirya. Stambhane Himaha. So, Shitavirya is indicated. Among the rasa, six rasa, Shad rasa, Tikta, Kashaya and Madhur are considered to have this Ratta Stambhana Karma. So, whenever there is bleeding from nasal bleeding or oral bleeding or through anal canal, through Mutra Marga or even through Garbhashay, Rakta Pradar as a disease, we have to use Madhura Tikta Kashaya Rasa and Shita Virya to stop this bleeding disorder. Now it is very easy and nothing new in it. My point is Shitavirya becomes common in all these three Shadrasa. Where to use Tikta Kashaya Rasa and where there is a more need of Madhur Rasa is our today's topic of discussion. Now, always remember when the bleeding from any orifice, nasal, oral, or through anal canal, etc., the first thing to be examined is whether there is a local pathology has happened. For example, when there is bleeding through the anal canal, you have to consider the common diseases which are external piles, internal piles, fissure, or some diseases which are in relation with the intestines like ulcerative colitis. When there is a nasal bleeding, you have to think of the any deformity at the nose, or does the patient has tendency to have nasal bleeding especially in the summer season, or is there any pathology has happened locally like nasarsha? When there is hemoptysis or mukhagat raktasrav, always examine first the gums condition because many times the gums are fragile, and because of during the brushing or by any means that because of fragile gums there is a bleeding through the sputum, and you have to think of that gums at that time. Whether there is from lungs in case of urakshata, shatashina, or in some cases of rajeshma, or in modern days it is called as tuberculosis. Another main disease where there is a bleeding in the sputum or in chardi is ulcers. Gastric ulcers specifically bleed in from the Udriyat Pradesh, and other ulcers or peptic ulcers or ulcerative colitis in the large intestine, the bleeding is through the anal canal. So when there is a bleeding from any orifice as a symptom, always consider that the local pathology is important, and in the case of Nasarsha, you have to give like the treatment in the gums, you have to treat the gums, etc. Here, two main things always you have to consider. First, शीतवीर्यात्मक or मधुरचित्त कषायात्मक द्रव्यास internally, and also local application of dravya which are capable of rakta stambhan. For example, when there is nasal bleeding, we can apply durvasvaras, we can apply only cold water or ice water. In the case of oral, when there is bleeding gums, you can apply churna like lodra, khadira, arjuna, the bleeding gums, so which will act locally and stop the bleeding. In the case of bleeding piles also, you can apply this dravya, for example, for external piles to stop the bleeding. So, along with the internal medication of Chitta Kashayam, Madhurashita Vidyatma Dravya, always remember local application helps a lot to stop the bleeding, because when region is at the or hetu is located at the local region, hence the local application helps very fast to stop the bleeding. Now I am mention one thing, that Madhur Shetavirya is common among the Shadrasa. Madhura Pitta Kashaya, how you will choose which rasa is more beneficial. Now, as we saw the list of the bleeding disorders which cause of bleeding as a symptom, whenever there is mouth ulcers or ulcerative colitis, gastric ulcer, peptic ulcer is a cause, or even like fissure, there is a bleeding with the stools. All these ulcers come under the name Vrana. These are the Vrana which are formed internally. Fissure is on external side, but it is Vrana also, and you have to heal the wound, whether it is an ulcer in the gastric region or peptic region or in the large intestine in the form of ulcerative colitis. So in this case, Pitta Kashaya Ras and Shita Virya will help to stop the bleeding, no doubt about it. You can use that dravya, but to heal the ulcer, you will it will be preferable to use Madhur Rasa and Shita Virya. For example, Yashti Madhu, Sariva like dravya, which will stop the bleeding as well as which will heal the cause, which is the ulcers formed in the body. So when Shonida Sthapan Karma or Rakta Strav bleeding disorder is a symptom of some of the other cause, you can use Madhurita Kashaya Shitavirya Dravya locally as well as internally to stop the bleeding. If there is a cause like ulcers anywhere in the body or fissure like condition, to heal that wound form, Madhur Rasa is more preferable to remove the cause. So, Shonida Sthapan, you can differentiate between these three rasa according to the patient's need. Now, a question for you. Stambhani Himaha Shita Virya will stop the bleeding. Okay. Whether Ushna Virya can be used to stop the bleeding. I repeat, Shitavirya Stambhani Himaha is routine we use to stop the bleeding. Whether Ushna Virya can be used to stop the bleeding, the first question. And Shonita Sthapan, by word Shonita Sthapan, we always take it as a Rakta Stambhan. But in Charak Tika, they have mentioned another meaning of Shonita Sthapan, which is very important clinically also, because we come across that such patients frequently. They have mentioned in the Tika that Shonita Sthapana Sthairya Karam, Rakta Sthairya Karam, which is also very important part or definition of Shonita Sthapan. We will discuss this in the next episode. Thank you very much.